We'll start with a vacuum. I don't actually have a vacuum, but basically what a vacuum is like a little disc type of thing. It's basically a round piece of plastic. It's not too awful big. It's like about that big. Um, and what it has is like a almost like a diaphragm. It's kind of like this squishy material, like kind of rubbery. It suctions to the top and they kind of like pump it up and they keep the suction on. So whatever part of the head is presenting, which is usually this part if you're lucky, or like maybe up here a little bit, they suction it on to the top of the head and they will pull on the cord. And what that does is allows the baby, gotta love my props, right? So usually when you're pushing, what ends up happening is baby will kind of go like this. As you push, they'll come down. As you're pushing, they're there, and you stop pushing and they kind of come back. So if this was laying on your back pushing, this is what it would look like. So they come up, they rock. Once you push enough and they come up over top of the tailbone, then their head usually stays there. This is where you would feel what they call the ring of fire or that type of thing. It's when you are fully dilated and baby's head is actually presenting. So what ends up happening is with the vacuum, they keep that rocking motion from happening. So they'll stick the vacuum onto baby's head and they'll actually keep baby right there. So when you push, there's no like rocking back and forth, and they'll keep the baby right there, which helps that to kind of, I don't know, it speeds it up a little bit because there's less time of baby like kind of going back and forth. Now,
it almost looks like a plunger.
yeah, it does. So it's got that soft kind of squishy part on the end that suctions, and then there's a part that they pull on that actually like holds the traction right onto the head. Yeah. So what ends up happening is because of that suction, what you'll find is that underneath where the vacuum was, is there will be swelling and there will be a bruise. Because baby's skin and baby's head, I mean, it's brand new skin, right? And it's really easy to bruise and it's easy to have swelling. So because of that, there are a couple of risks that are associated with that. So the bruising, it can increase the risk of jaundice a little bit, which is not something that is untreatable. Jaundice is typically treated by lots of breast milk or formula. And if it gets to that point, then you would go under one of those little like UV lights or whatever, because it will break down with light and it'll break down and be flushed out of your system. But increasing bruising increases the risk for jaundice. So that kind of goes both ways with forceps and with a vacuum. Babies can be a little bit sleepier because they have now experienced a form of trauma to their head, right? So having any type of bruising or swelling, as minimal as it may be, in a lot of cases, it still is there. So they could be a little bit more sleepy because it's been a bigger process than usual. There are, I don't know, I mean, those are kind of the biggest risks of the vacuum, is like increased sleepiness, which can contribute to breastfeeding issues if baby is really, really sleepy. So, I mean, there are ways to kind of mitigate that. It can also happen if you get a lot of medication in labor that happens. But usually the biggest one is kind of that bruising and that trauma to their head, which can cause the jaundice and which can cause some sleepiness.